Hi, everyone. I'm Dr. Valerie Leva. I'm a clinical supervisor with BHRS, and I do some training series for the training department, such as this one for interns and new associates. Today, we're going to talk about play therapy with children. I think it's appropriate to use play with adults who are willing to do that. It helps them access material that sometimes is a little bit buried in their subconscious or unconscious. But primarily today, we're going to talk about child-centered play therapy, why it's important to children, and how to talk to their caregivers about it so they don't just think that you are playing. So let me share the screen. And here we are with this training. Let me get it centered for myself. Okay, so since you're looking at this online, you're not needing to turn on your camera or mute yourself, etc. To review, we're going to talk about play therapy, which includes games, play, and art materials to assist the person to express themselves, particularly when there are no words for them to describe the experiences they have had. This is useful with children who are very young when they experience trauma or other adverse circumstances. It's particularly used with folks who don't have words to express thoughts, feelings, or memories. So the learning objectives for today is to understand how and when to introduce play therapy and how to explain its use to caregivers. And we're going to talk about three play therapy methods to utilize with either children or adults, but again, primarily we're talking about kids. I just want you to take a minute and think, what activities have you used with children or adults to help them express their feelings when they don't have words? This can be in a therapeutic context or with your own kids or children in your family or children you've worked with in other settings, such as school settings. So stop for a minute, maybe write down for yourself, what activities have you used with children or adults to help them express their feelings when they don't have words? Excuse me. When you've done that, come back to the slides. So let's talk for a second about how children learn. Children learn by observing. I love to watch kids in the preschool or daycare because you can watch them develop these skills. They'll watch somebody else do something and they'll try to repeat it. They might not have the finer gross motor skills to do it, but their natural tendency is to want to do what the person next to them is doing or to do what you as the parent are doing. So then they're going to engage in experimenting. So how can I do these things in a way that makes sense for me? How can I get this block into this hole or this hoop on this piece of string? Then they're going to rehearse as well. They're going to practice these skills as they grow. Sometimes we continue to rehearse even as adults. Pro athletes rehearse a lot about getting that hoop or hitting that ball. So rehearsal is a really important part of learning. And then children also engage in fantasy play where they make up stories, particularly children 5 or 6 years and younger will engage in fantasy play, which is really important and enriching for them in order to expand their social context or social environment, help grow those neural pathways about, well, what if kinds of play. So that's why fantasy play is important. So, what is play therapy, or why do we use play therapy? So, children don't necessarily have the vocabulary or emotional maturity to describe what happened to them, or what is difficult for them, or what is bothering them. If they have a bruise on their arm, they can point to it and cry, or boo boo, or owie, but we don't know where to point when it's an emotional issue or something about their adverse experiences in the home setting. But this preoccupying experience frequently interferes with the children's ability to focus at school or establish or sustain friendships. So it's that nagging thing that they can't really articulate, but it's bothering them, but they don't know why, often because they don't have the emotional maturity to describe it either. So that's why we use play therapy. So the activities that are included in play therapy can be just about anything that's considered play. You see an office here that's starting from the right. It's got a puppet theater. It looks like it has costumes to dress up in, a dollhouse, a whiteboard, a little blue thing to put supplies in. I love the little green chairs at the white table because I wonder what that is in the background. Is that a chalkboard or is it a let's engage in fantasy play. It's a portal to another forest or another experience. Then you can see on the wall to the left, there are shelves with lots of toys, and in the middle is a sand tray. So This is kind of an ideal setup for a therapy office for play therapy. You don't have to have that because most of us at BHRS don't have the luxury of having an office setup like this. We can talk about how you can make some of these things portable, and you don't have to bring everything at one time. Maybe one week you'll bring puppets, or another week you'll bring costumes, or another week you'll bring coloring books. Another week you might bring food toys and a little kitchen setup. So there's tons of things that you can use for play therapy. So it includes all these play items. It includes water, which is interesting with really young children. Play, guided imagery techniques, relaxation techniques, drama, puppetry, even poetry for kids who are a little bit younger, movement, reading, music, board games, and creative games. So you can be very creative in how you set up play therapy with the kids you work with. And it doesn't have to be expensive because many supplies you can get at the dollar store or Walmart, or maybe you could inherit from another therapist who's upgrading some of their supplies. So it's good to stay in touch with your colleagues and see what might be useful to them. So it's sometimes challenging to explain play therapy, particularly child-centered play therapy, to caregivers. And our goal is for the child to develop an understanding of their own feelings and where these feelings come from, and to practice healthy and appropriate actions to take in response to them. So this is a video that I thought was very useful. It's a 4-minute explainer. I would use it with caregivers, show them this video, get them to report on their phone. I think you can click on this link. Oops, sorry about that. You can click on this link and get the video to open up. So take the 4 minutes to watch this video before you move forward. Okay, I hope that video was helpful to you. And let's talk about the 8 principles to follow in child-centered play therapy. It's important to understand that the therapeutic relationship is the primary technique of this intervention. Any play activities you do are fine. Obviously, you have rules about your office where I used to have rules of we don't throw things across the room, we don't hit yourself or me, and we've got to be safe in the room. And what does that mean to that child? But then these 8 principles are really important. So it's really important to develop a warm, friendly relationship with the child. Just like the good old Rogerian centered therapy, accept the child unconditionally. It's okay to establish a feeling of permissiveness in the relationship. Now, this is not the idea that you let the child do anything, throwing things around the room or tipping the sand tray over. However, it is not about correcting a child's behavior, coaching them with certain words, that kind of thing. So the play itself is very permissive, but within the bounds of not trashing your office or having a safe relationship. You recognize and reflect the feelings of the child. So you may verbalize the feelings of the child. The child might be engaging in some kind of play, and you can ask, what are those two people doing to each other? And the child might say, one's hitting the other. And you can ask, well, why is he hitting the other person? He says, because he's mad. Oh, wow, that character's mad. When people are mad, it looks like they hit each other, right? So you don't correct it. You don't say that's the wrong thing to do. You just verbalize it for the child. You respect the child's innate ability to solve their problems, which most children can do at a particularly at their developmental age. You don't expect them to act older than what they are chronologically, but children do have an innate ability to solve problems at their developmental stage. You do not attempt to direct the child's actions or conversation. You recognize the gradual nature of the child's progress. So this is not an overnight kind of deal. This isn't a CBT intervention where the steps are laid out and we follow the steps in a fairly linear fashion. Um, you only establish those limits that are necessary. And I would say necessary for safety. If you have an experience with a child, for instance, a child did dump out my sand tray one time. I didn't bring the sand tray out for a long time with that child. So it was didn't know she was going to do that, didn't expect that. But that was an act that for her was either anger or a lack of control or something else. It was a while, so I don't remember it. But after I cleaned it up and I was matter of fact about it, I didn't scold her about it. I would say, oh my goodness, you dumped the sand tray out. And I tried to connect it to her therapeutic process. And I asked her to help me clean it up, and she did. And then we put it away, and I just didn't bring that out again. Same thing with other uncontrollable mediums like water. Um, Also, don't have things in your office that you don't like dealing with. I hated glitter when I was doing play therapy. So I didn't have glitter. I had the little glitter glue pens, those were fine. But just loose glitter made me nuts because it would get all in my clothes. I couldn't ever get it out. So don't have stuff in your office you don't want to deal with. So, knowing that it really is a therapeutically permissive environment, we have to figure out how to talk to caregivers because caregivers will say, I want you to tell her to do A, B, or C. Aren't you talking to her about this or that? Even I've had a caregiver of a 6 year old say, I want her to talk about her trauma narrative. Like, well, that can be helpful, but it might not be helpful to that child. What's more helpful is for the child to play through the trauma narrative. So these are ways to talk to parents. So here are some scripts to talk to caregivers about what you're doing in play therapy. First, I use play and art materials, which are natural forms of self-expression for children, and turn this language into whatever you need to for the parent, so that the parent understands it. Translate it in ways that make sense to you. So my role is to pay attention and accept your child with sensitivity, so that they're free to show me their problems, their fears, their trauma reenactment, etc. So yeah, my role is to observe and to ask the child to explain their play somewhat, so that it begins to start making sense to them, and they're free to show me what they're afraid of, what the problems are, what is the trauma. Another thing you might say, by providing a safe and non-judgmental environment, your child can explore their ideas and creations through art and play and decide if they like the outcome. And then your child will begin to, whatever the issue is, trust themselves and rely on their own judgment rather than worrying about the views of others. Your child will be able to test expectations and begin to build trustful relationships with other caregivers, particularly children that are moved from foster care placement to foster care placement. Um, your child may be able to experience themselves as capable and responsible, which they haven't had the opportunity to do before. Or your child will begin to play through the trauma narrative and develop some understanding that they were not at fault. But these are just different ways of describing it. I also put an assessment piece in there. Play therapy also lets me assess if your child has issues with attention deficit or autism or depression or attachment issues or anxiety issues. And then I can recommend a few other options for addressing these. So these are some ways of explaining it to caregivers, I think, that are useful. And we do have to explain it to caregivers. I think it is reasonable for folks who are not trained therapists to kind of look at what we're doing, say, but you're just playing. And how long will this take? They're usually the two comments I get. And I sometimes say, well, it takes as long as she or he needs for it to take. This is not cognitive behavioral therapy. She's too young for that. Or um, she uses her words in a way that's not helpful, like the child is yelling a lot. This is a better way to help her or the child express their feelings, their thoughts and feelings, and for me to get a sense of what's going to be helpful for them. So I want you to take a minute to think through, what is the script you're going to use to explain play therapy to a caregiver, and what are some of the issues that you want to point out? So think about the kind of population you work with, whether they're littles or kind of middle childhood age, like 9 to 12 years old. Um, Kids over 12 years old, you can still use play therapy. They more likely will engage in art materials or writing poetry or song lyrics. But think for a minute and write down, what's the script you're going to use to explain play therapy to a caregiver, and then come back to the video when you're ready to do so. So today we're going to look at three types of play therapy techniques. There are hundreds of play therapy techniques. I just find that the ones that people are most comfortable with are sand tray, puppets, and board games. And these are sand trays, a little heavy, but I always just buy a plastic tub at Walmart or the dollar store to put the sand in. Be sure you buy play sand. You can usually get that at Home Depot or Lowe's or some other contract type of organization. Um, and I will have like the ones that are maybe a foot and a half long, a foot wide, and 6 to 8 inches deep. That gives enough of a play surface, and was something that I could carry. Also consider getting one of those foldable wagons that you can keep in the trunk of your car, easily transfer to a county car. So if you want to have a bigger play sand tray, you can have that. And you can carry that easily into the school or the home. So what is a sand tray and why do we use it? So the theory behind sand play, which is a psychoanalytic development, starting in the 1950s, 60s, when psychoanalysis was still the major form of therapy provided other than behavioral therapy. And it creates worlds that represent the client's inner struggles or conflicts. And sometimes when I start the sand tray, I'll ask a child, do you want to make a movie? Let's pretend you're making a movie and we can use the sand tray to set up the characters. Or I'll just introduce it to the child. Would you like to play here and use whatever figurines you'd like? Depends on the child's age and their understanding. So when you do sand play, the therapist and client typically discuss what was observed, the toys chosen, how they were arranged, and any symbolic or metaphorical meaning they may have. So I'll watch and say, what did you bury in the corner there? Oh, it was a baby. Do you know why the baby was buried in the sand? What happened? Oh, okay. The child will tell me why. Oh, okay. And I will, especially with younger children, I will just observe. I will verbalize my observations and ask them if they can tell me a little bit about it. I don't try to pull any symbolic or metaphorical meanings. The child who's older, maybe 8, 9, 10, I might ask them, do you know what all this means? Do you have a title you'd give this story? What would be the name of this movie? Oh, what is this scene about? Okay. So with kids, you get, again, depending on the age, you're either just going to verbalize your observations or you're going to try to help the child come to greater meaning. And then the client can choose to rearrange the toys based on the discussion. The baby may go back under the sand. She might sit on grandma's lap, or she might get put in the wagon, or somewhere in the house, or thrown across the room. You never know. So sometimes kids will rearrange the toys based on the discussion. And then what I would do with my with my county phone is I would take a picture of the sand tray when it's done, because it's amazing to watch over time as the sand tray goes from being really disorganized as the child heals and begins to make sense of their story, how much more organized the sand tray becomes over time as you work with the child in sand tray. And it's really useful to have pictures. So this is how it works. You allow processing the meanings that the clients develop and assign to their experiences by monitoring, observing their engagement with the toys or symbols they choose to play with. It's typically a pleasurable sensory experience that facilitates natural expression of emotions. And this can be useful for kids that are neurodivergent, whether with autism or sensory integration disorder or ADHD. And it absolutely reduces the psychological distress of discussing traumatic events or experiences. And so a lot of times kids, even older kids, don't want to talk about it. And I don't blame them. And I don't want to poke that sore place with them. And so it's a way to engage in that without being harmful to the child. So sand tray, you buy play sand. This is different from kinetic sand, which you could also use, but for sand tray, you buy play sand. You can buy small figurines at the dollar store. You can make your own. I always made sure that I had plastic figurines. When I did this session after session after session, I had a bucket with bleach in the bathroom near my office. And at the end of the session, I dumped those figurines into the bucket so I could sterilize them. That was long before COVID. So certainly now it's really important, especially with young kids who'll put things in their mouth, to make sure that you sterilize things. Then there's also a company called playtherapysupply.com. I'm going to click it and hope that it opens. I think you can click directly from your your link. And so you can see here they have sand tray therapy figurines, they have starter kits, they have the play sand, everything from shelving, which you can make yourself. If you want to buy the starter kit, here's like a platinum starter kit with it's got people, first responders, signs, cars, cones, uh, ocean figures, farm figures, little houses, barriers like fences, things like that, trees, older people, younger people. So those are some of the things that can be helpful in having in your sand tray. But again, I didn't buy professional stuff unless there was something I really, really, really wanted. Like especially when I wanted to find whole sets of families of color or different ethnicities, then I would go to Sand Play Supply. The rest of the stuff I'd buy at the dollar store. So puppet play, what is it? Puppet play is the use of puppets to represent, again, people, objects, thoughts, and behaviors through play. And this type of play can also help children develop social emotional skills as well as promote healthy coping skills. So, this is where the child is taking on the characters that are interacting. So, it's a little bit different than sand trade, which is symbolic. This is more direct. And so, it is a way where you can find out what's going on in a child's life by exploring what's going on in the relationships between the puppets. As you can see, you do not need fancy puppets. You can have color characters and put them on popsicle sticks. You can even get the youth to make their own characters. So again, not a lot of money. So puppet play works this way. The client identifies with the characters involved in the puppet play and projects their feelings and interpersonal conflicts into the play. Sometimes the play is just also straight up reenactment of incidents. This enables the youth to communicate their distress without having to directly claim the traumatic experience and painful emotions as their own. So this is a way to distance the child a little bit from the trauma. So they're not talking about their trauma, but they're acting out a trauma with the puppets. So it gives them some space to not have to own the emotions of those characters. It also allows individuals to experiment with different characters and explore how to cope with their emotions and experiences from that character's perspective. So think of a child who's experienced trauma and how differently they might express their feelings as a turtle versus a dinosaur puppet. So if I'm using animal puppets, and I would have animal families as well, and this is where I did spend more of my money for my supplies, I would have an animal family of pigs, an animal family of dinosaurs, different families that might express different emotions. Family of turtles, you hide. Family of dinosaurs are going, right? So if they're playing with the turtle, I'd ask, what do turtles do? And if the child knows, he said, well, they pull in their shell and they feel protected. Like, wow, I wonder what the dinosaur would say if they were in that situation. Like, go, grrr. So that I could talk about emotions related to those types of communication styles. So resources needed, all different kinds of puppet characters. I had people and I had animals, and sometimes I'd have plants. Every now and again, you'll find some kind of promotion somewhere. I might get a tomato puppet or something like that. It's all good. So this is a really interesting video that you can click on where this woman is talking about all her different puppets. Her favorite puppet is her turtle puppet because you can pull in all the arms and the head. Um, and I had puppets that were human, representing the different races or characteristics in the stories of various cultures in my area. I might have, I didn't go necessarily for like commercial characters, like Disney characters, but um, I would have, well, we're all in Central California. Technically, I'd have a child puppet that would represent Hmong culture or a Native American culture or a Filipino culture, just to have some ethnic variety. And honestly, finger puppets are a way to start because they're super cheap. And drawn figures, such as in the slide that started this section, are really helpful to use and just put them on popsicle sticks. Sometimes for a while, I had a set of family figures that were just drawn and I laminated them so that they would hold up over time and then glued them onto the popsicle sticks. Excuse me. So again, this is a way to engage in play that's not directly asking the child, what happened? What did you do? And it's a way to help them be able to express themselves and their feelings without having to directly own that emotional trauma narrative. So the third type of play we're going to go to is game boards. And it's the use of stock therapeutic or self-created games to help clients to develop numerous social emotional skills. I had a carpet like this in my office, and you can get them 35, $45. They're usually about 4 by 4 feet, 5 by 5 feet. That had a school, a hospital, police, fire station, and I spent so many hours with kids driving the little car around with the little tiny figurines I'd have they could put in the car and driving around and visiting all these different places. So that's also a useful way to do a very non-directive play. So games and board game play is a little bit different than client-centered play therapy. You're following rules to a game. Now you can play games where you make up the rules, or you can take stock games and make up the rules according to what the child's needs or desires are. But if you do play by the rules, it helps children with emotional processing, functioning within a structured activity, mastering emotional skills, particularly disappointment, losing a game. Sometimes winning a game can push a child over the top. Helps you help children read social cues, helps them organize information, planning, using memory, and tactile experience again. In an era when play is mostly digital now. So here's a really interesting video of a gentleman. It's a little bit longer, maybe 10 or 12 minutes. He's used Candyland with an extra set of cards called Feelings Candyland. And some of my past associates and interns have said you can buy those cards of color-coded cards. And but again, they're easy enough to make on your own. And depending on what kind of spot they landed on, the child would pull a card and describe the emotion for that card or what would that character be feeling. So it's an interesting way of using a stock, just cheapo, buy it at Walmart family game that you can modify for therapeutic use. You can use other game boards and board game play and cards. You can do things like checkers, war, spades, crazy eights, rummy, chess, Jenga. Uno is good for sequencing, taking turns, organization, executive functioning, patience, reduction of impulsivity, etc. So you can use any kind of these card games, which are easy to carry around, and you can get checkers that are easy to carry around. Comes in a little box. You can make up your own board games. There are templates online for you to print out, usually on 4 pieces of paper, and you can tape them together and then laminate it if you want to do that, or you can glue them to cardboard so that you can fold it up into fours. But there's also therapeutic games that are specifically therapeutic. Don't Go Bananas, Head Rush, Conversation Cubes, Mad Dragon. For older kids, sometimes you can just buy the card sets for like the talking, feeling, doing game. And you should always edit your card sets for the age of the child because some of them are teenager questions, some of them are very young questions. So you want the right questions in there. And there's also games that are specifically therapeutic, such as one called CBT or CB Trip, helps children understand how thoughts influence their emotions and behaviors. So again, this is just a really quick overview of play therapy, the kinds of tools you can use for play therapy. The other thing I always had was coloring sheets. I would have like a blank heart, just an outline of a heart, and ask the child to use the crayons to fill in how much of what particular feeling they had in the heart. They'd assign the emotion to the color, have faces, blank outlines of faces for kids to draw. You can use masks. Sometimes I would laminate the masks and again put them on a popsicle stick so we could hold up a different mask to our face and we were the giant puppets. Sometimes is how we would do it. So use your imagination. I provided play therapy as a direct provider for about 15 years, and I really loved doing it. And one of the things I loved was that I could play all day and didn't have to talk about the trauma narrative all day, just helping kids process play. There's also therapeutic books. You can read books with the child, um, clay, markers, all kinds of things. So just be creative and use what you think would be useful for your particular client. So because this isn't online, I need to take this out of our PowerPoints. Um, this is not the next training you'll have. But share in the chat or think for yourself, what's one aspect of play therapy you're going to explore this week? So while you're an intern or an associate or a trainee, it's a really good time to begin to explore these things and begin to develop your bookshelf and begin to develop your storehouse of toys that you're going to use and tools that you're going to use with youth. So I hope this training has been helpful to you, and I look forward to seeing you live online at some time later this semester. Thanks. Bye bye.